You're most welcome to today's talk. It's Friday the 14th of May. Some news from the UK this morning. Still quite concerned about this India variant, obviously. Then some news from the US, where things are looking very encouraging for people that have had 2 vaccine doses. And then we'll finish off with a report from Australia. Now, starting off with the UK, first of all, this is the REACT study. This is worked by Imperial College London. They reported yesterday, the 13th of May. And you might remember REACT 1 is the study where they look at antigen prevalence, the virus itself. And REACT 2 is where they look at the antibodies, the immune reaction in the body that the virus has left, looking at antibodies particularly. But this one is REACT 1, so it's looking for the antigen, the virus. Now, they've actually screened 127,000 people. It's an impressive study, this. And they are PCR tests. So if these patients are positive, they are going to come up as positive with the sensitive PCR test. So 127,000 people swabbed, 115 turned out to be positive overall of the UK. And this was up to the 3rd of May. So up to the 3rd of May, the prevalence in the general population, and this, of course, the great thing about this study is because it's just looking for the antigen, is it includes symptomatic and asymptomatic people. It's just the overall prevalence of the virus. And it was 0.1% of the population, which, of course, is 1 in 1,000. Based on the previous study that they did up to the 30th of March, okay, it's a while ago now, but that was 0.2 or 1 in 500. So the number is going down nicely, but from this they infer that the R value is actually 0.9. So it's not plummeting down. Recently it's been going down, yes, but going down gradually. So 0.9. So it's heading in the right direction. It's below 1. So the numbers are going down, which of course is what we want. Since January, the link between the rate of infections, hospitalisations and deaths has decoupled. And this is, of course, exactly what we expected because of the vaccinated people getting less severe illness, less hospitalisations and less deaths. And of course, in the past, the number of cases was inevitably followed by the number of hospitalisations and deaths. Tragically, as we're seeing in India now, where so few of the population have been vaccinated in percentage terms, whereas now in the UK it's uncoupled. So people can still be getting the infection, but fewer people are dying. So there's this decoupling, whereas before it was always coupled. We used to say it was inevitable. We used to say it was baked in. And we assume the reason for this decoupling, or the overwhelming evidence really for this decoupling, is the vaccination programme. So that is good. Now, this is not good. B117, 24 of the positive samples. I know there was 24 of the positive samples. So basically they've sequenced 26. I think they sequenced 26 of the 115 positive samples. So they're not all sequenced. But what they found was, from random sampling, unfortunately, the B1617.2, the one we're worried about from India, 2 samples came back as positive. The B117, the UK variant we all know and have come to detest, but is now mostly under control, 24 samples. So they estimate that 92.3% with the B117, as we expect, but it's increased to 7.7% of the sample of those sampled of the India variant. Now, there was 2 samples came positive for this India. This is the most transmissible form of the India variant, the B1617.2, both from London, both with no travel history. Now, this is why this is concerning. So in other words, just by looking at random samples of the population, they'll come up with 2 people in London, both positive for this contagious form of the India variant, but neither with a history of travel, inferring they caught it via community transmission. Now, let me show you why I'm so worried about this. Here we have the this is from a few days ago, from Chris Whitty's briefing. So we know that the vaccine is now being given out to 38 and 39-year-olds as well. But last week, when this, well, actually just 4 or 5 days ago now, when this slide was put, it was over 40s. And as we see, of course, it's dramatically reduced the total number of deaths, which is wonderful. There still are deaths in the younger age group, though, just at lower rates. So that's all so far so good. But this is the one that's really quite concerning. So this group here on top have been vaccinated. The older age group have been vaccinated. But of course, this leaves all these younger age groups that have not been vaccinated. Therefore, many or the majority in this group are still immune to this virus. Not immune to this virus. What's the word I'm looking for? Naive to this virus. They've had no experience. They are not immune. So these ones here are likely to be immune because they've been vaccinated. These ones are not. And these are the ones that are going to be interacting with each other and could potentially spread the India variant. So my concern is that the India variant is probably going to spread around the country in younger people. That is what I'm concerned about. And of course, this was why we were so keen that flights would be curtailed or stopped from India. But of course, they weren't. They just they carried on for a long period of time. So this is the risk. And it is looking like this India variant is more transmissible. It's hard to say, but it's looking like it's more transmissible than the UK variant. Whether it causes immune escape, whether it causes more severe disease, we still don't really yet know, but I now suspect we're going to find out. And as I've been saying for ages, it's not something we want to find out, but now it looks like we are, alas, going to find this out. Right, next. Yeah, it's just a few other things on the UK variant, India variant in the UK rather. Public Health England, cases up to today, I think this was published yesterday on the 13th of May, 1,313 cases have been identified, but these are just the ones that have been sequenced. And if we're sequencing, I think at the moment we're sequencing roughly half of the positive cases, so it's reasonable to assume that we're only picking up half of the India variant as it starts to circulate in the UK. May the 5th, just a mere 9 days ago, it was 520. So more cases of the India variant being picked up, and it's spreading, well, we assume it's spreading mostly in younger unvaccinated people. At least we kind of hope that's the case. We hope it's not spreading in vaccinated people. We don't think it is, or not significantly anyway. Anyway, Department of Health and Social Care. Ministers cannot rule out reimposing economic and social restrictions at a local or regional level if evidence suggests they are necessary to contain or suppress a variant which escapes the vaccine. So this is what we're worried about, what I've been worried about for about a month now. They say regional restrictions are possible, but you've got to question the value of those, as we looked at yesterday, because it looks like it's already spread, albeit at a low level, but already spread to different parts. There's currently surge testing in 15 areas across England to try and get it. And where there's clusters, they're increasing genomic sequencing. So where more people are coming back positive, they are doing more sequencing to see if the cause of the increasing incidence in a particular area is powered by the India variant. So cases like we noticed Bolton, where am I gone? We noticed there was an increase in cases in Bolton yesterday, and those cases were, the reason that cases were increasing was because of the India variant that was powering this increase. So that's the concern. Let's hope this doesn't happen too far afield. They're talking about bringing forward a second vaccine for people who are eligible. And this is kind of official now, so the Prime Minister said it's a variant of concern and we are anxious about it. So it's kind of watch this space, really, because this will circulate in younger people, I believe. And of course, as we open up more on the 17th of May, that's only going to exacerbate this spread. Is it going to cause a lot of more hospitalisations and deaths? We are highly hopeful, not because we believe that people that have already been vaccinated are going to enjoy a higher degree of protection against severe illness and death, but there are unknowns and we'd really rather not find out. So that's the situation in the UK. Really, we'd hope to be putting this to bed by now, but unfortunately international travel has been the downfall there, as we've already stressed many times on this video. Now, moving on to the United States, So we've got reduced cases. This is the number of cases. Daily cases are going down. They're going down more significantly now, which of course is very good news. Deaths in the... So the figures there, let's look at the figures. I mean, we're still dealing with 35,000 new cases per day as a rolling average there. Deaths in the United States, unfortunately, still going down really quite slowly. But they are going down, but going down more gradually. So still new deaths, 645 per day on that. 7-day moving average of 603 over the past week. So they are going down. The deaths are going down, but they've taken a long time to come down, and that's reflected in the overall number of deaths, now 580,000. This is a lot of people have died. Current death figure, 580,837 have died in the United States. Now, on the positive side, one dose, 46.6% of the whole population, not just part of the population like we do in the UK. Fully vaccinated, 35.8% of the population. Now, I haven't got I haven't got precise figures here, but the rate of vaccination in the United States has gone down somewhat. It's still over 2 million a day, but it's down from over 3 million a day. So really, it is the onus now is on individual Americans to get out there, get vaccinated, and it's open even to adolescents now, as we've looked at recently. Is it 12, 13, 14, 15-year-olds, I think, from memory. Anyway, younger people are definitely allowed it. So that's good. It's getting rolled out, but it's more slowly. It needs to be quicker. Now, but having said that, we were worried for a long time about the race between, that's the death figures, that's the daily cases. Go onto this website for yourself. There's all sorts of interesting things. We were worried back in about this kind of time that the cases could go up more, but the vaccines seem to have kind of caught up. So this line here represents vaccines winning over the transmission of new variants. Not saying there's no risk left, there still is, but so far it's looking good. But there again, it's looking good in the UK, but we're worried about the India variant, of course. So far, vaccinations are winning. Had there not been vaccinations, it really doesn't bear thinking about, does it? The effects that it could have had on the population. Now, Centre for Disease Control yesterday, 13th of May. Now, read this for yourself. It's pretty interesting. When you've been fully vaccinated, and there's a whole list of things that you can do and can't do because you're fully vaccinated. But I'm just going to give you a bit of a pre-say of that, just to try and break it down a bit. And it is interesting that the United States are taking a very different approach to the UK. We haven't got any of this. If you've been fully vaccinated, you can do all sorts of things that you couldn't otherwise do in the UK, whereas in the States they have. So the United States are saying, well, there's these rules for the fully vaccinated and different rules for everyone else. In the UK, the rules are kind of all the same. What's not clear from the CDC website is how this is going to be evidenced. All I can assume is that they are relying on individuals to know that they're fully vaccinated 14 days after their second dose of vaccine, and to behave accordingly, and for people that are not to behave accordingly as well. There doesn't seem to be evidenced in any way at the moment. But of course that may change, and it certainly will change for international travel, I strongly suspect. Now, so that's the website there. If you've been fully vaccinated, you can resume normal activities you did prior to the pandemic. Pretty strong language, but that's what they're saying. Resume activities without wearing a mask or staying 6 feet apart. Okay, looks like you can hug people again, which is nice. Except where required to locally. So, okay, that is a proviso. So a workplace, transport, of course, could be obvious. Shopping facilities, malls could be obvious exceptions. Domestic travel. Do not need to be tested before or after travel or self-quarantine afterwards. So basically liberation on domestic travel there. Do not need to get tested before leaving the United States unless your destination requires it. So the US is not requiring testing before exit of the States. Still need a negative test or evidence of recovery before boarding an international flight to the United States. So you still need a negative test or evidence of recovery before boarding an international flight to the States. So that is good, but as we've seen, it doesn't catch everyone. But this is the current CDC guidelines. Should still get tested 3 days after international travel, which is, okay, it's good. But of course, it's not saying that you should isolate. It doesn't seem to comment on that. It doesn't seem to be saying that. You do not need to self-quarantine after arriving in the United States. It does say that. It's exactly what it says. So it says actually you do not need to Right, okay. Right, you do not need to self-quarantine after arriving in the United States. Well, from some countries, I would have thought that's a bit of a dangerous strategy, but it's not for me to argue with the Centres for Disease Control. If you've been around someone who has COVID-19, you do not need to stay away from others or get tested unless you have symptoms. Now, this is what these guidelines are doing, which is quite interesting. They are differentiating between symptomatic and asymptomatic infection. So here they're saying, basically, if there's a risk that you've been infected but you don't have symptoms, don't worry about it. If you've been around someone who has COVID-19, you do not need to stay away from others or get tested unless you have symptoms. So it's just if you become symptomatic. There is exemptions for correctional facilities, detention facilities or homeless shelters. Although quite why that would confer a higher risk, I'm not entirely sure, but that's what they're saying. Right, for now, if you've been fully vaccinated, follow the guidelines at your workplace or local business. Of course, we all have to do what we're told at work. Masks on planes, buses, trains, domestic and international travel, that makes sense. International arrivals, test within 3 days. So they're saying test within 3 days of international arrivals. But they're saying you do not need to self-quarantine after arriving, but you should be. So that's the do not need to. This is telling you what to do, so you should be tested within 3 days of international arrivals. If you're symptomatic, stay at home. Stay at home, that should be if symptomatic. So again, differentiating between people that are symptomatic and not. Weakened immune system on drugs or whatever. Of course, talk to your healthcare provider. So they're the rules. Now, to what degree is this based on evidence? Is not fully published, but it does seem to be consistent with new data from Israel, which I'm just going to run through this paper briefly now from Israel. So this is the association between vaccination with the Pfizer vaccine and incidence of symptomatic and asymptomatic SARS coronavirus 2 infection amongst healthcare workers. Journal of the American Medical Association, 6th of May. That's the link. So again, this is new work published, and there is a lot of this kind of work coming out of Israel now because, of course, they were well ahead with their vaccination using the Pfizer, exclusively, I think, using the Pfizer in Israel. Now, it's a single-centre retrospective cohort study, so it's looking back at a group of people, Tel Aviv, Israel. Data were collected on symptomatic and asymptomatic SARS coronavirus 2 infection, confirmed by PCR testing. So this is all confirmed by polymerase chain reaction testing, so that's good. Now, December the 20th to 2020 into February the 25th, 2021 was the study time. 6,710 healthcare workers. So these are good size samples. Symptomatic SARS coronavirus 2 infection. Incidence rate of the fully vaccinated people. So this is for fully vaccinated people now. So this is the key thing we need to look at. So first of all, symptomatic infection. Incidence rate of fully vaccinated people was 4.7 cases per 100,000 working days. And of course, this was carried out in a healthcare facility, so they're interested in people's working days. So there you go, fully vaccinated. Now, this actually, in Israel, when they said fully vaccinated, they actually said 7 days after the second injection. We now know that the immunity carries on increasing for another 7 days after that. So they actually took that 7-day cutoff after the second injection, but immunity carries on increasing after that. So after that, this would make the vaccine look even more efficacious than these figures are indicating. So 4.7 cases per 100,000 days in fully vaccinated people, compared to the unvaccinated 149.8 cases per 100,000 days. And of course, if you compare that number with that number and the number of people involved, that difference is significant. In fact, I think it's highly significant. That is a good difference. In fact, it certainly would be highly significant. And that gives a 97% protection. But that's plus 7 days, so maybe slightly higher after that. So good protection against symptomatic infection. But what about asymptomatic infection? Slightly different, interesting, slightly different. Asymptomatic infection, incident rate of fully vaccinated people 11.3 per 100,000. Incident rate in unvaccinated people 67. So 67 out of 100,000 for asymptomatic picked up by PCR testing. And that works out at 86% protection against asymptomatic infection. And of course, if someone's only 3% there got there's 3%. That's the wrong way to look at it. There's 97% protection is the best way to look at it. Leave that at that. 86% protection here. But of course, the point I was trying to make is for this 86% that don't have the infection, if they don't have the infection, they can't pass it on. And obviously what I was trying to say there is these people that are protected aren't going to pass it on either. So we can expect reduced onward transmission, is the point I wanted to clumsily make there. And this is consistent with what we're seeing in Israel with the reduced number of cases and deaths. So good couple of figures there. 97% protection against symptomatic infection after 2 doses. 86% protection against asymptomatic infection. So that kind of that difference between 86% and 97% does kind of give a rationale for the way the CDC are differentiating between symptomatic and asymptomatic infection. It does kind of make sense. But we see the excellent levels of protection afforded after 2 doses of the vaccine. And of course, all those regulations that we're reading out there were for people that have had 2 doses of the vaccine plus 14 days. So this does seem to make sense. So fully vaccinated people mixing basically allowed now in the United States, whereas in the UK it's not. It's different. It just goes by everyone changing the rules all at the same time, as will happen on the 17th of May and then hopefully on the 21st of June. So it's interesting. The difference between the 2 countries' approach here is interesting, but we're both probably doing equally well at the moment. So you can't really say one's better than the other, but it is interesting the slight difference in approach. Now, last thing I want to do today, following on yesterday from the situation in Goa, where the Goan authorities are recommending ivermectin prophylaxis for everyone. Now, I haven't heard that they modified their protocols yet, as we thought might be beneficial yesterday. But this seems to be sort of catching on in different countries now. People are asking the question. And here the question has been asked in France, the question about the efficacy of ivermectin that we've been looking at as an antiviral preparation. Now, this is a letter from 1,500 doctors to the French Health Ministry asking for an emergency use authorisation for ivermectin. Now, this is, first that was on Twitter, but then this is the letter published here. So you can read the whole letter. Now, when I click on that, I get the title in French, but the Google Translate translates the article for me. So you can see it's kind of not always a perfect translation, but it's perfectly obvious what it's saying. So I've put in a few clips here. Now, bear in mind this is via Google Translate. But doctors are asking for the right to care for their patients. Well, I would have thought doctors caring for their patients is probably a good idea. They say that ivermectin met the risk-benefit ratio analysis. direct quote, chemoprophylaxis is relevant to stem the pandemic. So they're saying here that medicines to prophylactically, as a prophylaxis. And the idea here, of course, is if you had an antiviral medication, it kills the virus in an individual, that individual is no longer infectious if the drug has eradicated the virus from the individual. Now, the quote Vigibase here, pharmacovigilance data, 130 countries past 30 years. Now, over the past 30 years on this Vigibase pharmacovigilance data, as quoted in this letter from the French doctors, ivermectin has caused 16 deaths and 4,700 adverse effects. And we believe that 3.7 billion doses have been given. Actually, it's unclear from the information I have whether it's 3.7 billion people or 3.7 billion doses. Anyway, it's a lot. But nevertheless, it's caused 16 deaths and 4,700 adverse events. But of course, no drug is completely safe. And then they go on to give an example. And the drug they use here is Dolifrane. Now, Dolifrane, in the past 30 years, has caused 3,695 deaths and 161,147 adverse reactions. And this is a trade name that's used in France. So what is this? Is this some particularly dangerous drug that's caused 695 deaths and 161,147 adverse reactions over the past 30 years? Well, in my country, we call this drug paracetamol. In America, you call it acetaminophen or Tylenol. So that's just pointing out that no drug is entirely safe. And yet we seem to be prepared to accept the risks of paracetamol, acetaminophen, Tylenol. So I thought that was interesting, just comparing those two. So from this, they say that ivermectin is a very, very safe pharmaceutical. Read it for yourself, that's what they're saying. Writing to the Minister, 31st of March 2020, National Medicine Safety Agency rejected our request for a temporary recommendation for the use of ivermectin. This represents for us a serious threat to public health. Pretty strong language. Pretty strong language. Now, we're going to finish with one of our favourites, Dr. Nigel Farrier from Perth in Australia. Always interesting report, so let's get straight on to it. Thank you, Nigel. Remember.
So I thought I'd give you a quick update on what's happening in Australia. In the last day or two, the Australian government has done a deal with Moderna, and they're going to get 25 million doses delivered to Australia. When this is going to be, I've got no idea. The other thing that our government has said in the last week is that our borders are likely to be closed for the rest of this year. So no foreign holidays, I'm afraid. But with regards to India, it's likely that in the next few days we'll be opening back up and bringing back some of the Australian nationals that are in India. They've opened up a quarantine centre in the Northern Territory, and they're going to be taking them there. So that's good news for some of the people that are stuck in India. On the thing of opening up, Western Australia, which is where I am, has not had a case now for it's almost 2 weeks. And so as of tomorrow, Saturday, because I'm recording this on Friday, we're virtually back to normal. Masks are still going to be required at the airport and on flights, but otherwise venues are back to full capacity. Our stadiums and sporting venues can have 100% capacity. So we're virtually back to normal. We have been pretty close to normal for the last few weeks. So this is all good news. There's in the world thing, there's a new vaccine being developed in France called Valneva. It's very similar to the Sinopharm in that it's a inactivated COVID or coronavirus, and the thing that's different about this one, and it's still in the research phase in France, is that it uses the whole virus rather than viral particles, which is what I think the Sinopharm uses. And so what they're saying with the Valneva, that because it's using the whole virus, you're going to get antibodies against more parts of the virus, and therefore may well cover some of these variants of interest and variants of concern. So that's still going to be at least 6 months away, I reckon. The only last thing is that I finally got my COVID vaccination yesterday. So did my wife. So it's now 26 hours, give or take, since I had it, and I've been fine. Did feel like I'd had my shoulder hit with a baseball bat about an hour later. That lasted an hour, and other than that, I've had no real side effects. My wife, however, has been somewhat sick. She came down last night with chills, fever. She's been had a high temperature until about half an hour ago, when it seemed to have settled. So that was a good 12 hours. She's had headache, nausea, dizziness. So she's beginning to feel a bit better now, which is, as I said, about 26 hours. The only other thing was, about an hour or so after I had my vaccination yesterday, it was announced that there'd been 7 new cases of TTS, which is the thrombosis with thrombocytopenia syndrome. Those 7 new cases bring the total in Australia to 18 of the AstraZeneca vaccination, and 1.8 million doses have been administered. So that's a risk of about 1 in 100,000. All these people who got TTS were over 50, because that's what we're giving the AstraZeneca vaccination to. The ages were from 59 to 80, several people in their 70s. But I think on average, it's still, on a risk-benefit ratio, better to have the vaccination than not. So thanks very much, and I hope that's a quick update on Australia for you.
I think I'm back on. Am I back on? Yes, I am. Nigel, thank you, of course. What I was going to say is Nigel's got over 40 years of medical experience, so well worth listening to. Okay, Australian borders closed for the rest of 2021. And a special vaccine, a special quarantine area in the Northern Territories. That's interesting. Australia carrying on its very cautious approach, which is why, of course, life is normal in Western Australia, and in other areas of the world it is not. Yeah, I've been following that whole virus vaccine thing. That's interesting. I actually quite liked the sound of that when I first heard it. So we'll certainly be watching that with interest. This is how we use. This is the old-fashioned way to make vaccines. You just get the whole virus and you attenuate it or kill it, and then you inject it. Now, glad to get you and your wife have got your vaccine. We hope Mrs. Farrier makes a full recovery soon. It sounds like she is recovering already. And I agree, 18 cases out of 1.8 million, 1 in 100,000 cases, small amount. And of course, doctors know how to treat this much better now, and not to give the heparin as various guidelines have told us. Okay, so always good to get reports from around the world. Appreciate that. Thank you very much, Nigel. And that is us for today.